Well, good evening. Thank you for joining us tonight at 5. I am Rolly Hoyt.
And I'm Faith Woodard. President Trump's proposed One Big Beautiful bill made its way through the Senate, and now it sits in the House. But tonight, it's facing pushback, especially from those in the healthcare field.
THV11's Maya Ellison joins us now with what this could mean for patients, providers, and rural hospitals here in Arkansas. Maya?
Yeah, Rolly and Faith. Now, one policy in the bill that has many turning heads is the proposed changes to Medicaid coverage. Those I talked with today say if the bill passes, our state hospitals will feel it.
The Vice President votes in the affirmative. The bill as amended is passed.
The main goal of President Trump's sweeping legislation is to extend the tax cuts Congress approved back in 2017. It would also add eliminating taxes on tips and overtime. But to pay for those cuts, the plan aims to reduce how much the federal government spends on Medicaid.
It's very frustrating.
Neil Reeves, health policy chair for Arkansas Nurses Association, is back from D.C. after lobbying against those Medicaid plans. The bill calls for new work requirements and a freeze on something called, quote, provider taxes. Both will affect hospital budgets and the nurses who work in those hospitals.
So roughly a third of our state is on Medicaid and stand to potentially be affected by any kind of cuts. And some of the cuts could be something as simple as they're putting a pause on some of the provider taxes, meaning there's no increase. We may see providers shut their doors. We may see hospitals shut their doors because financially they just can no longer survive.
Millions of dollars are at stake with more than 800,000 people enrolled in Medicaid right here in Arkansas. And after a federal judge stopped an earlier attempt by Arkansas to put work requirements in place in 2018, Reeves worries those problems will return.
If this passes, is Medicaid patients today have to recertify once a year, and the proposed changes says now they need to do it every 6 months. And so it's already a complicated system, and now we're further jeopardizing their health care because now they have no health insurance whatsoever.
Republicans in Congress dispute the effects critics are predicting, but to Reeves, if some of the problems he's worried about come true, it will cost the people he represents their lives.
Nurses needing to look for jobs, maybe uproot their family and move to a more populated area to even have a job, or travel great distances to have a job.
CBS News reports that House Republicans are still working to garner support for the bill. President Trump put a deadline to get it on his desk by July 4th. That probably won't happen, though, if the House makes any changes tonight or tomorrow.